Hello everybody. My name's Shayne Lynn. I'm the executive director of Champlain Valley Dispensary, which is here in Burlington, and then Southern Vermont Wellness in Brattleboro. And also joining me today is Bridget Conry. She's our GM, general manager for the dispensary. She's also in charge of creating our edibles. It is. Does that help? How's that? Is that better? How many of you are healthcare professionals in here? Great, excellent. Um, how many of you already have patients in the program? Great. Um, how many of you know the differences between CBD and THC? A little bit, all right, good. How about indica versus sativa? All right. And then how about, did you know that there's different methods of consumption for cannabis? All right, great, super. All right, well, we're going to try to cover a lot of those topics today. So we're going to break the presentation into two parts. I'm going to give you a little bit of introduction to the bigger picture for industry issues that we're going through right now. And then I'm going to give a little more about the Vermont background. And then Bridget's going to come in and start speaking about the experience at the dispensary. And we're going to talk about kind of four challenges that the industry, healthcare providers, state, patients, we all kind of need to be involved in to help move this forward. The medical cannabis industry is moving rapidly. It's changing incredibly fast. The information that we had just 6 months ago is new, and it has changed to this point. For us at the dispensary, we're changing incredibly quickly. We started with 2 to 3 people. We're now up to 40 employees. We recently hired a HR manager. We're bringing on a controller. That's kind of the back of house. At the front of the house, at the dispensary, we're starting to look at possibly hiring a pharmacist, hiring nurses, other kind of healthcare professionals, maybe social workers, back to realizing that our clients, we sometimes switch between calling people that come with us patients versus clients. We like to think of them as clients. They're your patients. When they come to us, they're clients. Back to much of the science behind plant-based medicine is still evolving. We're still learning a lot about what CBD is and what cannabis strain will provide the most CBD. The plants themselves are evolving at this point. As we start to breed these plants, we can breed them to have more CBD. We can breed them to have more THC. We can breed them to have certain, basically, ratios of CBD to THC. And also part of that evolving science on using cannabis is coming up with those formulas. For us, that means we recently have licensed an agreement with a Colorado company to provide transdermal patches. Those patches are going to have different formulas in them. They're going to have a THC to CBD, a 1-to-1 ratio. They'll have a 5-to-1 ratio. Some of them will be very completely non-psychoactive. Back to the law then. The law is changing rapidly too. What you can do or can't do, it's a process. We learned a lot at the front of the lines. We go back to the state. We go back to the Department of Public Safety. Department of Public Safety's the state troopers. They regulate our program. When we learn stuff, we go back to them. We ask them to help us basically change the rules and regulations so we can better serve our clients. Part of that is also the rapid change is a real disadvantage to the regulators because they can't stay up with how fast things are changing. And so we're really looking in the industry to help start to create some standard manufacturing practices. That'd be the back of house, back to the production of cannabis, making sure that there's really standards there when we produce not only the plant but the edible products that we're offering, the tinctures, and then CO2 extraction oil that we do offer. Again, back at the front of house, that means having standardized educational materials to be offered to people, making sure everybody's getting the same message on how to use cannabis effectively for symptom relief. For us in the industry, taking responsibility is really, really important to make sure that this program survives. Again, back to the everybody in being involved in that. License holders, which is ourselves, the state, healthcare professionals, and the patients. We all need to understand the laws, the rules, the regulations, and the standards of which we're operating from, so expectations can be met. For us, again, we're trying to take the lead on that. That's where we really appreciate being here, being able to provide this information. We want to make sure everyone has the right information as we move forward so that this program is a very responsible program. We developed this relationship with the state. For us, we're the only people with the direct experience working with patients that are using medical marijuana. We have to bring that information to you guys currently. We need to be the bridge to the community, to the state, to the healthcare providers, and tell about the experiences that we are seeing every day at the dispensary. For us, that's a matter of really also creating a culture of responsible use. I think there's lots of stereotypes out there right now about cannabis, and part of what we would like to be a part of is changing those stereotypes. We see a lot of different types of people from our community here in Burlington and Brattleboro come into the dispensary, and people that have used cannabis before, maybe for a long time, to people that have never used it before. And so they come in having not used it before and have a lot of stereotypes and think a lot of things about cannabis, and part of our job is to demystify how to use the product. Part of that responsibility is providing transparency. And to highlight that, over in Maine, there was a group, Maine Wellness, which basically had a product recall, and they did that on their own, and which we see as really what our industry needs. We need to be policing ourselves, and them doing a recall, I think, shows that our industry is growing up, and that we need to have these steps in place to make sure that the products that we're offering are safe and have not been contaminated. Just some real quick information on the Vermont background. There's probably roughly 1,800 people total right now in the registry program. There are 1,000 people that are visiting us at this point at Champlain Valley Dispensary and Southern Vermont Wellness. There's 4 total dispensaries in the state: Burlington, Montpelier, Brandon, Brattleboro. We are all nonprofits. We all have a board of directors. We're all vertically integrated, meaning that everything that has cannabis, anything that's a medicated product with cannabis in it, we produce it in-house. From growing our plants, harvesting them, drying them, curing them, bringing them to the kitchen to create the edible products, turning them into concentrates, which is hash, keef, CO2, extract oil, tinctures, all those things we produce ourselves. Each of us, each organization produces their own cannabis. We're not allowed actually to sell to one another, so we each create our own cannabis products. So we see about 40 new patients a month coming in for us, and we try to do monthly outreaches to healthcare professionals on top of that. Back to visiting people, we're happy to come talk at your office. We're happy to have an open house at our dispensary and sit down with small groups of people to talk about the program, to talk about the products that we're offering. So that's kind of an open invite. In 2016, this upcoming year, we're looking at changes in our program. Currently, we're only allowed to serve one person at a time. They must have an appointment for that too. So they make an appointment, they come in. We can only see one person. We see roughly maybe 20 to 25 people a day, max. That's going to change in 2016. We're going to be able to see up to 3 people at a time. Another part of that change is we're going to have delivery. So people will be able to place an order with us. We will deliver the product to them. With delivery, there's limitations though. They're not going to have the same kind of selection. They're going to have to determine what they want before we drive out to them. So we see the dispensary as really integral though. There's a lot of community that gets developed at the dispensary. There's a lot of information that's shared there. The delivery program won't necessarily have that aspect to it. And so we are going to probably most recommend that people have to come in first, sit down with us. We give them a survey, get the information we need from them, and then be able to deliver to them. Other part of 2016, back to, I've already mentioned transdermal patches. We have other licensing agreements with Colorado and other states at this point to try to bring in other products, basically. Back to, there's no product going across state lines, but we're using their intellectual property, their knowledge, and we're licensing that to make products here in the state. The one part about cannabis that we really think is a huge benefit is the diversity of products that can be offered to a client. You can have dried flower, you can have an edible, you can have a tincture, you can have an oil, basically. And so those diversity of products can be used in a wide range of ways. And I'm going to let Bridget actually talk about some of that and let her describe what the experience is like coming to the dispensary for the patient. What are the products that they are able to use? And then I think Bridget's also going to talk about testing. We test all of our products at this point so that we do know what the THC levels, what the CBD levels are, what those ratios are. So I'll let Bridget go from here. Do I have another slide? Oh, I do have one last slide. Back to this information is collected from the registry. And as you can see, major disease is cancer. Major symptom is pain at 76%. There's other diseases, cancer, AIDS, MS, and then you'll see other down there. The other is epilepsy, neuropathy, ALS, cystic fibrosis, debilitating arthritis, and then we see a lot of traumatic injuries, people that have been in accidents that have serious disabilities with a lot of pain associated with that. Again, so the symptom is pain there. So, all right, Bridget.
Hi, can you hear me okay? I came to work for CBD. My background is in food production. I've been running commercial kitchens for about 20 years, and the quality control that goes along with that and safe manufacturing processes for food products. I've also been studying medicinal herbs for about 12 to 15 years, making different tinctures, salves, and those things. For the communities that I've lived in. I did not come to this with cannabis experience, so we have drawn on my knowledge and then knowledge from other states and people who have been active in this industry prior to us to help us get us up to speed on how to process cannabis to make effective products. We are not healthcare professionals, and I think that's really important. We just spoke in front of the New Hampshire Medical Society last week. They invited us to come because they have a program now that they're developing. Licenses have been given, and the medical community there wants to understand what's coming their way. And it was actually enjoyable for us to have, we spoke in front of them. There were cannabinoid researchers from around the country. There were doctors working at Dartmouth-Hitchcock. They had a legal perspective about doctors' risks or supposed risks in terms of recommending or prescribing cannabis. And so to have the researchers and the doctors get up there and say, we don't know, we don't know, we don't know, was comforting because we don't either. We can represent our products that we make, and because we're vertically integrated, we can tell you every step of the way what's happened to them from the moment they were planted as a seed or as a clone straight all the way up to when they were packaged and delivered to the dispensary. We know what the mediums they were grown in. We know everything about that product. So what we don't know is that this is an unsettled science. Because it's federally illegal, people have not been able to study it. Researchers, universities, doctors, organizations, they don't have the science supporting all of the anecdotal evidence that is out there, and there's an incredible amount of anecdotal evidence. What we do know is that every product behaves differently in every body. So our job at the dispensary is to help people navigate the products based on the tendencies that they have and how people have generally used them in the past. But our goal is to say, this is your journey, this is your trial and error process to figure out what's going to work well for you. We can't tell you. We can't tell you this product is going to help you with your pain management and you need to take 3 drops 5 times a day. That's not how it works. And that can be very unsettling for people who are used to that model of being told exactly what to take. That being said, the role of the physician, the state of Vermont, they have a verification process. The physician or the healthcare provider doesn't actually recommend or prescribe cannabis. All they need to do is verify the qualifying condition and verify that they've been treating that patient for at least 6 months. There is a new rule that actually allows for healthcare providers to verify without the 6 months in cases of new diagnoses that are terminal or sudden, like a traumatic injury. So that 6 months can go away if it's a new situation that needs help immediately. So the patient right now is responsible for taking their form to their doctor to get signed and get verified. The physicians do not have to sign it. There is no law that says if the patient actually has a 6-month relationship with them and they have the qualifying condition, the doctor does not have to sign it. And we run into that a lot. We have people who call us and say, hey, I have a qualifying condition, I have this relationship, but my doctor won't sign it, what do I do? We're not in the position to recommend doctors. So they really do need to try to find another doctor. We don't share, the doctor's names of people. We don't even know them all the time. We do have a survey that people fill out, and if they want to say who their doctor is, they can, but we don't share that with anybody. So they take the form. It's on the website, which is the Vermont Criminal Information Center actually runs the medical marijuana registry. So you go to that site, you pick the registry, and all the forms that a patient or a physician would need are on there, as well as all of the rules and how the statute was written word for word. So it's a great website to reference. So they get their doctor to sign a form, then they have to fill out an application. The application with the verification form goes to the Department of Public Safety. As Shayne said, it's the state police who run our program. That's the only state in the country that has a program that's run by the Public Safety Office. Usually it's the Department of Health, and in some cases the Department of Commerce. So once the application reaches the Department of Public Safety, they follow up on it. They follow up with the doctor's office and they make sure that is a real verification form, that all the information on there is correct. Once that's done, the person gets registered, and then they need to choose a dispensary. Unlike other states where once you're on the registry, you can shop at any dispensary that's licensed to dispense. In the state of Vermont, you need to choose a dispensary, and you can only use that dispensary for the next 90 days. You're locked into that choice. After that, you can choose another one, and then you're locked into that choice for 90 days. So, we think it's important that people have that choice because we're vertically integrated. We're not necessarily going to have the product that's going to work for that patient. So it is good that they can switch at least after the 90-day period. So we get a list every week from the state. Every Friday, the Department of Public Safety sends us a list with updating all the changes that may have been made to our previous list and all the new clients who have chosen us. Once we have that list, most of the time we've actually already gotten a call from the person saying, hey, I'm on the registry, what do I do? If they haven't, then we reach out to them proactively. In that first initial phone call, we talk to the patient about just the basics of what they need to bring for us to serve them. At the first appointment, they need to bring their registration card They need to bring that every single time or we will not serve you. The first time you also need to bring another government-issued photo ID that helps us to verify your identity. After the first appointment, you don't need to bring that ID. We make copies of both and we have to have them on site all the time in order to serve a person. Just to be clear, we do go back and forth between client and patient because we're not healthcare professionals, as Shayne said. So we try to refer to them as clients, but I will go back and forth just out of habit because the state calls them patients too. And we need to call them patients when we reference them. When we have communication with the state, we don't reference people by name. We reference them by their patient number for privacy purposes. So in that initial conversation, we talk about their 2 ID cards that they need to bring. We talk to them about the fact that they need to bring a locked container. The law states that they cannot take away their purchases from our facility without it being in a locked container. So they need to bring that or else they can't go home with it. And then we have a bunch of forms that need to be filled out. And if it's ideal for the person to fill those out and review them at home if they can. By law, we do have to provide educational materials to people who register with us, so part of the initial forms are just that. They talk about the different subspecies of cannabis, the different cannabinoids that are being researched and what they're known for generally, as well as the different methods of consumption. So it's great to read that ahead of time, so when you come in, it's not all brand new. There are also communication authorizations. We want to make sure that we're protecting people's privacy, so we want to know, hey, when we call you, can we say who we are? Can we leave a message? Same way with email. Is it private? What can we use? What's the best method to communicate with you? We have guidelines of sensible use. We have our privacy policy. We have disclaimers. This is the patient's experience. We're not responsible for your experience, and sometimes when people are first experimenting with cannabis or with a new product, there is the possibility that you might over-medicate and take too much and find yourself in a place that's uncomfortable. We do have them sign that form that we're not responsible for that. And then we have our symptom survey, and in that symptom survey, we inquire about the person's symptoms that they're looking to relieve. This is not a curative program. We're not talking about medicines that might help people cure their qualifying condition. So we want to know what they're looking to address, and we also want to know if they have any cannabis experience. So we have a starting point. So that's the first phone call. And then they come into the dispensary, and we talk about financial budgets, first off. This is an out-of-pocket expense. It's not covered by insurance because it's federally illegal. So it's expensive just by that nature. The pharmaceuticals are paid for generally by insurance. This is not. A person can buy their full 2 ounces and that could cost $800. So that's a lot of money to spend a month. Not everyone needs that much or spends that much, but there's that potential. We do have a sliding scale program. By law, we're required to have a compassionate program to serve people who have financial need. When we first started, it was just 2 pricing structures. People who met the qualifications for the federal poverty level received one price and everybody else received the other. But we quickly learned that, it's not just the poorest of the poor who need help here. Everybody does because it's out of pocket. So we developed a true sliding scale based on household income that allows more people to get some discount to help them pay for these purchases. So that is available. We also do give a veterans discount. And then we just talk about how much money that person has to spend in the appointment, and we try to figure out, with that budget, what are the best purchases that they can make to get the most relief for the money that they have to spend. And certain products, like the edibles that don't necessarily cost as much, can have a long duration of effect. So it's trying to figure out what exactly they need and what works for them and trying to make it work for their budget. We then go into talking about the different subspecies, and most people who are familiar with cannabis have heard the terms indica and sativa before. It's kind of like the roadmap for how to determine which of all of the options have certain generalities. So indica is known to be generally sedating. It tends to be more of a body feel. People tend to use indicas during the nighttime when they're trying to go to sleep, and they're having a hard time doing that because of their symptoms. Sativas are the flip side. They tend to be stimulating. They tend to be more of that heady feel. Most people use those during the day. That being said, those are just generalities. They can have the exact opposite effect in anybody. So once again, it's a trial and error process. So we talk about those subspecies, and then we talk about the major cannabinoids that people are familiar with. Primarily THC and CBD are the ones that people are most familiar with and get the most attention. THC is the one that's known to be psychoactive, the one that gets people high, but it also has a lot of effects that help people manage their symptoms. It's an analgesic, it's anti-inflammatory. Some of the high THC strains are the ones that help people increase their appetite, reduce their nausea. So there is the psychoactivity, but there's also a lot more. CBD is the one that's non-psychoactive. And tends to be known for its anti-seizure activity, anti-spasmodic. It tends to reduce anxiety. It tends to be a great pain reliever. That's all the anecdotal evidence that we have, and more we have PubMed docs that are documenting that that is the case for certain people and with certain illnesses. So we talk about those two, and we have products that are THC dominant. We have products that are like 1-to-1 ratios of THC to CBD. And these ratios are getting more and more attention, more and more research, and finding that, hey, certain ratios work well for certain conditions. Once again, it might not work for every person with that condition, but these are, research is finding that they do generally work for certain ones. And then we have our CBD dominant products, which more and more people are choosing. That are non-psychoactive. Then we move into the forms of medicine. I'll do that on another slide. And we always talk about going low and slow. Because this is a trial and error period, process, even people who have experience, they don't generally know what they've been taking. You know, wherever they've been buying it from, they may not even know which strain it was. They probably didn't have test results. They probably didn't have the variety of products to choose from. So it's still a trial and error period for them. And you always want to take the least amount up front until you understand how it's going to work for you. So go low and slow. Small dose up front and wait a while, because sometimes the effect doesn't come on for a while, and you don't want to take more before you understand where you're going to be for a little while. So part of the orientation process is getting to know the names. You know, the cannabis strain names that are out there, I don't know if any of you are familiar with them, but these aren't our names. These are names that the breeders of the plants have generated, and often they're very colorful. I do appreciate that there's some humor in some of them. You know, I think humor is always part of the medicine, but there are some that are offensive, and we don't appreciate that at all, and neither do our clients. So we're talking about products that have these names, and our clients are coming in, and because they're usually not having the conversation with their health professional about their cannabis use, they come to us and they treat us like we're their health professional, and they tell us everything that is going on in their medical life. We hear about all the drugs that people are using, and they don't, just as our names are so foreign to them, the names that people talk about for all the different drugs that they're taking right now to treat their symptoms are very foreign to us. We don't know how to navigate those names. And a lot of the clients are coming in trying to figure out how to transition off those to cannabis so that they can have their symptom relief without maybe some of the discomforts that they're experiencing with their pharmaceuticals. So the primary methods of consumption. So inhalation is the first one. Inhalation is through smoking of the cured flowers or the concentrates or vaporization of those same products. It has the quickest onset time, so a lot of people prefer it for that because it can be a quick effect, 5 to 10 minutes in most instances, but it also has the shortest duration of effect, 1 to 4 hours. The oral mucosal are the sublingual sprays, the tinctures, the lozenges. These also tend to have a fairly quick onset time, longer than inhalation, but because the cannabinoids are entering through the lining of the mouth and directly into the bloodstream and not going through the digestive system, the effects can be felt sooner, and they have a longer duration generally. Ingestion are your food products, the foods and the beverages. So that is your traditional brownies and cookies and things like that, but it's also granola, it's energy bars. There are dairy-free options, gluten-free options, sugar-free options, all of those things, because all of our our clients have a lot of health issues, and a lot of them are on restricted diets. So they don't, they can't handle a brownie. So those have the longest onset time, and as I said, that's where a lot of the danger comes. We probably all heard the Maureen Dowd story, where she just took too much too soon. Edibles can take up to 2 hours for some people to feel, and so we always recommend, if you've never had an edible or this is your first time using this edible, that you take a very small amount and you wait for a long time, and you do it on a day where you don't need to be anywhere. You're not going to be driving, you're not going to be responsible for much. You just need a safe place where you feel comfortable. And we also recommend for people who are inexperienced. We have a lot of people who come in who've never used cannabis before, that have a trusted friend with you the first time you experiment with these products, just in case you find yourself in a place where you get a little anxious. Some of the products can create anxiety. Have somebody there with you to help talk you through it, because you will get through it, but it's helpful to have somebody there with you. So the benefit with food products, I mean, it takes longer to feel it, but then once it kicks in, it has the longest duration. And so if you over-medicate, then that's a problem, because you're stuck with that feeling for a long time. But the flip side is that once you determine if this product works well for you, then you have a long duration of effect. And so a lot of people who have sleep issues, especially sleep issues related to pain, because their pain is waking them up, this is generally the best option if they find one that works for them. And we find people reporting often that they're sleeping through the night for the first time, because they had a cookie before they went to bed. So that's always encouraging. The last one is tropical. It should say topical, because topical can be either a local superficial application like a salve, or a lotion that's really just treating a local area, inflammation, irritated skin conditions, joint pain. And then there are the transdermal patches that Shayne talked about that are systemic. They're generally local and fast-acting, and they're generally non-psychoactive, though some people who are really sensitive might experience some psychoactivity with a THC-dominant transdermal product. So I've just barely scratched the surface about talking about any of these topics. And one of the challenges that we find is that there's so much information out there. And as Shayne said, there's so much on the internet, and some sources are really good and some are not. And all of our clients are reading those things. A lot of them come to us because they've done research on the internet first, and they're thinking that cannabis is going to be helpful to them. So even though we have a ton of information out there to read, it's unsettled, it's anecdotal, we have a true lack of settled information, and everyone really needs to figure this out on their own. So that's hard. So there's too much information, but at the same time, there's a lack of solid information. And there's also a lack of standards across dispensaries within the state. We have the same laws that we need to follow to be compliant, but we don't necessarily have the same packaging. We don't necessarily have testing. There's a whole bunch of different, they don't have the same intake as us, possibly, so there's differences, and so when people are moving from one to the other, it would be nice that some things would be the same and familiar, because, a lot of people have discomfort coming into the dispensary for the first time, and it's really our job in that first phone call and that first consultation to provide comfort, and it would be great if that could translate if a patient discovered that, hey, I need to go to the Montpelier facility because they have what I need, and that they could go there and have that comfort of familiarity. And that's also across state lines. There are 23 programs now in the country that have medical programs, and states, yeah. And it would be great if there was some similarity in rules and regulations and dosage information across states too. So we do the best that we can in this environment. We do label all of our products with the strain that's in there, the amount of cannabis that was used to create it. It's called a weight equivalent. We are in the process of testing all of our products. Not all of our products have a label on it right now that says exactly what the milligrams of cannabinoids are. We're working towards that. There's a huge learning curve there too, and our state doesn't allow for outside labs to operate within the state. The only people who can handle cannabis in the state are the 4 licensed facilities and the patients. So we don't have an outside lab in the state who can verify our results for us, or even to learn from. So we do have lab technicians from other industries who are very skilled lab technicians, but they're learning the cannabinoid profiles, how to read them. We work with other lab technicians from other states that have cannabis labs to get all of that information secure for all of our products. So we're in the process of having labels on everything. All of our dried flower right now has percentages of THC in them, but not all of the infused products do, but we're getting close. We do put them in tamper-proof packs, and we also give all the ingredients for all of the infused products, once again, so people know what they're consuming. We're moving towards having a nutritional panel on all of them as well, too, so people can understand the amount of salt, fat, sugar that's in all the products so they can make informed decisions. Once again, the THC and CBD ratios are really important, but there are many other active ingredients in cannabis. So yes, we talk about those because those are the ones that are most talked about, but more and more we're learning that there are many other cannabinoids and other phytochemicals that are actually participating in the effects that people feel when they use these products. One of those is the terpenes. Terpenes are found in all plants. I'm familiar with them through my aromatherapy study. It's what makes clove smell like clove and lavender smell like lavender, and they have therapeutic effect, and you can smell those same terpenes in cannabis. So there are certain strains of cannabis that smell like thyme, it smells like oregano, it smells like citronella, it smells like rose. It's all in there, and it's interesting. They're starting to learn that these terpenes that create these aromatic profiles are related to how the cannabis works inside the body. So a lot more to learn there. What we see on a day-to-day basis in the dispensary and how that works is that people use their sense of smell to determine which products they want to use. And generally, if something smells good to them, that's the product that actually works for them. And if they're repulsed by the smell, and there are certain strains that they're repulsed by it. It's more terpenic. It might smell a little bit like gasoline, or it might smell like a musk, like the perfume musk. And if people are repulsed by that, that usually is not the product for them. So it's interesting how the nose knows that anecdotally. Okay. So there are a bunch of doctors out there now and cannabinoid researchers who are focusing on cannabis research, and all of them say the same thing: we don't know, we don't know, we don't know. We're encouraged by the research that's coming out, but it really, even the difference between indica and sativa now is coming into question. Like, that's how we orient people now, but now they're saying, hey, it might not be those categories that explain why indicas tend to be sedating. It could be the terpene content. And so some companies are, they're processing the raw material to just create THC. They're stripping, or CBD, or whatever cannabinoid they want, and they're stripping it down to just that, and just adding terpenes back to it. They're creating formulations that just, what are the terpenes, what therapeutic profiles do those have, and then the THC and the CBD, and they're making those formulas in labs. So we have a lot coming ahead on the horizon. Dr. Meshulam, if you follow cannabinoid research or research in other countries, he's very prominent in the Israeli national program. It's one of the most advanced programs in the world. They actually have cannabis therapy in hospitals there. They have vaporization rooms where patients actually go and they vape cannabis as part of their treatment in the hospitals. He's saying basically the same thing, that we have so far to go, and isolating just the cannabinoids or just the terpenes isn't going to produce the effects we want. It's that whole plant medicine. That's what he's learning in his research. These are just examples of the labels that we have. We do have to have the strain name on there. We put ranges of THC on there because, you know, this is plant-based medicine, and the plant, when you test the plant, you're going to get different cannabinoids at every level of the plant. You can test a flower from the top of the plant, test the flower from the middle, test the flower from the bottom, and you're going to get different results. They're not going to be wildly different, but they're going to be different. So we can never say that this package of flower, that everything that you test in there is 16%. It could be that one of the flowers in there is 16.5 and one of them's 15. There's just a natural variance in the way the plant distributes its chemicals in the plant based on its growing environment. So we put ranges on them because people really do get attached to the numbers, and we try to coach people away from that. But it's not about the numbers. It's important. It's a starting place, but it's not everything. We also use color. You know, as Shayne said, maybe this was in our last, because we just spoke before this. When people are experimenting with our products, we tell people to write it down. Get a journal. We actually even sell journals. Write down your experience. When you're starting with this product, write down how much you took. Write down what time of day it was. When you have an empty stomach, were you tired, how are you feeling? And then write down your effects so that you can better remember which products work for you and start to understand how you can take them most effectively. In cannabis, especially the ones that have THC in the psychoactive, that can lead to a hard time remembering what worked well and what didn't, especially if you bring home 15 different products and you're trying to figure it out. Often we have people come back and they say, oh, you know, like 5 of these were really great, but I can't remember which ones they were. So we got to write it down. And we used to find that people, when they're trying to figure out sativa and indica, they're like, which one is my daytime? Which one is my nighttime? And we found that we were like drawing, you know, suns on bags for daytime. And so now we use color. Orange tends to be stimulating. The blue is for nighttime. And it helps people when they have these packages at home to navigate which product they should use when. This is an example of another company. This is a Canadian licensed company. They use color too to help people navigate all of the products. This is a company that's chosen to take away the funny breeder names. You know, some companies do that. They change them completely and they make their own brand names. This one is Metrum. So the challenges that we face, as Shayne said, we are completely vertically integrated, so that has its own challenges. We have to figure out how to do everything, as opposed to being able to take somebody, you know, work with somebody else who already has that expertise. So we do grow it. We have our own lab. We have our own commercial kitchen. We have a packaging team, and then we have our dispensary staff. The staff, we're not medical professionals. We'd like to bring medical professionals into the dispensing location. We do have a couple nurses who work in the Brattleboro facility, which is great. We have a social worker who's starting to work at the Burlington facility. A lot of our clients, you know, because of their serious health condition, I mean, these are really sick people. It's not like Colorado where it's somebody coming in with a sprained ankle. Like, we're dealing with people who are really sick and who have a lot of physical, cognitive, emotional issues related to their illness. And having a staff that can handle that, you know, 25 patients, right, one after the other, who some days it's really easy, some days it's not, you know, because they're affected by what they're going through. And so it really helps to have somebody who's got that life experience and that work experience to handle people who can sometimes be difficult or emotional, who have a hard time organizing, you know, even having someone to help people fill out their financial assistance application. That can take some of our clients a really long time to figure that out. And so having somebody on staff who can work with them to get that done so they can get on the program as soon as possible. So we're excited because as we mature as an industry, we're attracting people who have that kind of experience. When we first opened, you know, people were risk averse. We didn't know if it was going to last. People didn't want to jump in and take that risk to work in there, so we tended to have a certain kind of applicant come work for us. We were fortunate. We found a lot of great young people who didn't have these skills that we feel are really needed on the dispensary end to work with our population. And now that we've been here a while and people are seeing the program working well, we're finding a different kind of applicant coming in and applying to work with us, which is great. So we're not we can't give medical advice. Each person must determine their own dose over time. We need standardization labels and warnings. We definitely need increased involvement from the healthcare professionals. We want to create that feedback loop. We do collect a lot of information on the front end. We've been good about that. You know, at that first patient symptom survey, there's a lot of good information on there for people who choose to fill it out in depth, and most people do. So we have what they've been taking so far and how often and what their experience is, and now we want to, you know, create what's the next checkup time. And I think that, you know, annually we're going to start having it. When you get your card renewed, let's do that again. And let's start collecting data on how your cannabis use has affected your health and affected your other medicine choices and uses. And then another challenge for the patient is the renewal system. So it is a yearly renewal, and once we see somebody's card is about 2 months away, we start telling them, if you're going to re-register, get moving on it now, because it can take a while. They have to have the doctor, the healthcare professional, re-sign the form, so it takes a while to get that to happen. They have to reapply with the state, so patients often suffer gaps because they don't do it in time. So we really try to get people like, hey, get on top of that, because when they have that gap, it's hard for them when they've come to depend on using certain products to help them with their symptom relief. And then the other challenge is the fact that we are a program set up for symptom relief. This is not curative medicine here that we're working with. It can be. There's a lot of anecdotal evidence out there that people are using cannabis products to help them shrink tumors and cure their illnesses, but once again, it's unsettled. And we don't have the ability to continually supply the products that are needed for those therapies generally, because we have limits. There's limits on what the patient can purchase every month, which is 2 ounces. And there are limits on what we can grow and have an inventory based on the amount of patients that we have. So every time a patient is added to our registry, that means that we can grow and keep an inventory, a certain amount of product. These curative therapies that people are using, like the Rick Simpson style oils that you may have heard about, the high CBD concentrated oils, the juicing, the raw juicing, require a large amount of plant material, more than we legally can keep an inventory. And yes, we may be able to make these products temporarily, but that's part of the issue, is that most of these therapies that people are using and they're finding success, it's not just a lot of product, it's a lot of product over a long period of time, months. And we just don't have the inventory to be able to supply the person once they've started it to continue with it. So we get phone calls every day from people looking for those therapies, looking for somebody to help them manage the treatment too. They want us to be their coaches, and that's not who we are, so it's hard. You know, it's hard to get those phone calls coming where people are really hopeful that they're going to be able to find these things through this program right now. And I'm not saying it's not possible, but right now, I think one of the only ways that people might be able to do that is to choose the home growing option. In this state, we do have the dispensary, and then there's the cultivating at home, but still, they're going to be hard pressed to be able to come up with that amount of plant material to have that process that they're looking to unfold there. So we're dealing with symptom relief, and the main symptoms that we hear about: pain management, number 1, sleep aids, appetite stimulation, nausea reduction, anxiety reduction. That's a big one. You know, people come in with a diagnosis and they're anxious about that, and so a lot of people use our products to help them relax, and then the opposite, this battling fatigue. So I'm going to hand it back off to Shayne.
We got roughly 5 minutes to go, but we got a couple more slides here. The other challenge is back to plant-based medicine and back to testing. And the cannabis plant, you know, there's cycles to the harvest. And let's say a certain strain gets harvested at 55 days. It will test a certain way. We may have to bring that plant down at 50 days or 53 days, or maybe it has to go up to 58 or 60 days. So if we harvest that plant on a different day, it's going to have different THC levels, different CBD levels. It's going to have different ratios. The other thing that affects our cultivation is the seasons. We grow completely indoors at this point, but the indoors is affected by what season we're in. And so that changes the plant. Back to testing samples, Bridget had mentioned results vary, top of the plant, middle of the plant, bottom of the plant. It's just the natural part of plant-based medicine that there are these variations. We've mentioned individuals respond very differently to cannabis. We all have an cannabinoid system, thank you. And we have CB1 and CB2 receptors. They're in our brain, they're in our spine, they're in our stomach. But we all respond differently. Something that may work for me won't work for somebody else. We'll have a completely different experience using that cannabis product. So back to individuals, Bridget had mentioned a person going home with maybe 15 different products. We sell really small sizes of the products so that people can try. So they're not going home with a huge amount. They're actually going home with very small amounts of cannabis so that they can try different things to find the thing that works for them. Back to dose determination, it's challenging. They've got to try it. They've got to experience it and then come in and talk to our staff and kind of go through that experience with our staff so the staff can, again, recommend things, but we cannot give direct guidance on that. So it's individual experience in the end for everybody that's coming in to use cannabis. Go low, go slow. 5 milligrams is the starting place that we think is a responsible place to start. You go out west right now to Colorado, you can purchase products that have 100, 500 milligrams of cannabis, THC, active THC. That's a huge amount. You're not going to die from cannabis, but the person will feel like they're dying, which is it's a horrible experience for them to go through. And so to avoid that, we always say start at the lowest possible dosage and then experience it that way, come back and then try again. Lastly, just information and education. The industry is new. We're all learning. We really need to create a feedback loop out there so that we can work with the patients, work with healthcare professionals. Right now, a person comes in, a client comes in and uses our product. We recommend that they make another appointment with their healthcare professional so that they can update their healthcare professional about the experience that they had with cannabis. But if they don't do that, that information is not getting back to the healthcare community. And that's where we need to start creating a feedback loop here so we can all be better educated on it. Again, I'm going to repeat it again, low and slow, it's where to start with everyone. Even with people that have been using cannabis for a decade, for them to come in and use an edible, they need to start at the smallest dose and go from there. Feedback loop I've mentioned. Lastly, we hear it every week. People come in, they're using cannabis, they're using fewer pharmaceuticals, fewer pain pills, fewer other medications. And we'd like to start to be able to have real stats on that. And so we're starting to collect this information. We're starting to work with a dispensary in Montpelier to have a broader base sampling to understand what's really happening. Part of this, though, for us is just time and having the time to collect this information and then review it. And at some point, we'd like to then present it to the healthcare community here in Vermont. So. That's a wrap, but if you have questions, we didn't save much time, but we'd love to answer anything. So, thank you.